Welcome back. On today's East Jefferson General Hospital Medical Moment, Camille Whitworth visits with Joy Melgar, the Director of Operations for EJGH Clinics, to talk about how they are enhancing care amid COVID-19.
It is no surprise that over the last several months, you've heard story after story of people who still have questions about seeing the doctor. Well, today we spoke with Joy Melgar. She oversees the physicians' clinics here at East Jefferson General Hospital, and she tells us that there are policies and there are procedures in place to make sure that you can come on in successfully and safely.
At East Jefferson, we want our patients and community to know that we are here to take care of them in a safe environment. Across all the clinical areas, we have put in place processes and methods to ensure that our patients are comfortable and confident that the care we deliver will be in a safe manner. Some of those processes put in place have been pre-screening phone calls prior to the day of their appointment. Upon the day of the appointment, we also do a triage at entry to include fever monitoring, temperature monitoring, symptom monitoring. We've also enhanced our environmental cleaning methods across all the clinical areas and the organization for that matter. Also, all clinic team members, providers are required to wear surgical masks at all times, and as well as patients and their authorized caregiver, they're also asked to wear masks, face coverings if you will, upon entry into our buildings. If they don't have them, we have protective equipment readily available for all of them. Additionally, we've also implemented a telehealth opportunity for those patients who are not able to come in for some reason for an in-person visit or just not quite comfortable yet. We do have the option for telehealth visit with our providers to ensure the care that they need and deserve is still being maintained.
Joy, tell me about the new normal, if you will. What does that look like here at the hospital?
In many ways at East Jefferson, we're already in our new normal of operations. Yes, things may change or pivot slightly over in the future, and who knows what that looks like actually. But at EJ, we're ready. We have our enhanced EVS guidelines, cleaning mechanisms. Those don't go away. Our protective equipment that we have in inventory and that our physicians and team members wear every single day, that's here. And if that's where we need to be, that's where we'll remain for now.
From a patient perspective, what does that look like to them?
Over the last 3 months, patients who have not visited our East Jefferson clinics may see new processes put in place upon arrival. At every entry checkpoint into our clinic buildings and across the organization, there are screening protocols and triage stations, if you will. At those stations, the patient will, and their caregiver that may be with them, will have their temperature checked. Symptoms will be assessed. COVID-19 symptoms per CDC guidelines will be assessed, and then they'll be provided a face mask if they do not have one in place. Across all of our East Jefferson clinics in the area, we have social distancing established in our waiting rooms so that our waiting rooms are not overcrowded. We also have, in some cases, remote check-in where the patient's actually triaged and checked in from their car, and those details are provided to the patient at our pre-screening phone call that we make.
Tell me about some of the procedures and policies that are in place right now, and then tell me how they may be surpassing the CDC's recommendations.
When patients present for their clinic visit at East Jefferson, they will see hand sanitizers, dispensers strategically placed across all of the buildings, inside and outside. They will see social distancing measures put in place in our waiting rooms to ensure that we do not have overcrowding in our waiting rooms. We also have put in place enhanced mechanisms for environmental services to meet and surpass CDC guidelines. Additionally, we also have check-in and triage stations which will assess the patient's temperature and to evaluate that the patient is actively having any COVID-19 symptoms per CDC guidelines. Looking ahead, we have the policies and procedures in place. Over time, we may step back from some of them as we see, based off of data that's been provided to us and guidelines from the state and local representatives. I do know that now, looking ahead, if we were to step back, we would be much more prepared and able to respond in a quicker manner now that we have these processes and protocols in place. So we'll be able to pivot very easily. As a healthcare administrator and registered nurse myself, this is essentially something I feel like typical to what we went through in Hurricane Katrina. For those who've lived in the greater New Orleans area, we are resilient, we are strong, and we will continue to provide the care that the community needs and deserves. East Jefferson General Hospital is here for you. We are here for the community, our patients who have been with us for decades, and those who wish to come and visit us. We are ready to care for you, and we are prepared to do so now and in the future, regardless of what occurs.
And so while a lot of those policies and procedures have been in place for a while, the enhanced services will likely continue well into the future. I'm Camille Whitworth. Thanks for watching, everybody.
Thank you, Camille. To learn more about this subject and more, visit East Jefferson General Hospital at EJGH.org.